Come on in. I'm going to perform hand hygiene. Hi, Mrs. Jones. It's Christina, your nursing assistant today. I have been instructed to provide you with some Care. Would that be okay?
Yes.
Great. I'm going to go ahead first and gather my supplies and my equipment for this task, and then I will get started. I'm going to provide you some privacy, and I will go grab my supplies. All right, Mrs. Jones, I have my supplies. For this task, I do have a waterproof barrier that will be placed underneath you to keep your linens nice and dry while I perform the task. I do have 4 washcloths, 2 for the front half of your peri area and then 2 for the back half of your peri area. I do also have my soap and a pair of gloves. So for this task, I will start off by raising the height of the bed so that it's a more comfortable level for me to work with. All right. Okay, Mrs. Jones, I'm going to apply my gloves. And now I'm just going to be exposing the area that I will be working with. So with this, I'm just going to remove your blankets by rolling them down to about knee level. And then right now I will go ahead and apply your clean barrier underneath your buttocks. So I'm going to move you towards me, have you bend your knees, and then turn you over to your left-hand side so I can apply the barrier. All right, Mrs. Jones, I have that underneath you now. I'm going to lower your knee, and I'm just going to pull it from the other side. Perfect. Okay, Mrs. Jones. Now that the barrier is applied, I can go ahead and move your gown up towards your hip, rolling it. All right, so I'm only exposing the areas that I'm working with, and I will begin with taking my first washcloth. Now for this procedure, I will be using the 4-corner method. I have my towel folded in 4s, and I will be applying soap to the corners. And I will take my first clean corner. I will be separating your labias, and I will clean the left labia first with a front to back motion. I will then take my next clean corner and clean from front to back the right labia. And then again, another clean corner, and we'll clean the vaginal area, front to back. Okay, I have done the washing. I'm going to go ahead and perform the same steps, but only with a clean washcloth with no soap. Separating the labias once again and rinsing the left labia with my first clean corner, front to back. Taking my second clean corner and rinsing the right labia, front to back. And then my third clean corner and cleaning the vaginal area, front to back. I've now rinsed the front part of your peri area. I'm going to go ahead and dry. How are you feeling? Good. All right. Miss Jones, I'm gonna move this down so that I can go ahead and work on your back part of your labia, your peri area. So I'm gonna have you bend your knee once again, and I'm gonna roll you to your left hand side. And I'm gonna expose your buttocks, and I will grab another clean washcloth. This will be my third washcloth, and this washcloth will have soap. And I will do that to the corners once again. With my first clean corner, with the soap, front wipe from the vagina to the rectum, front to back, the top buttock, front to back with another clean corner, the bottom buttock, front to back, and then my final clean corner, the vagina to the rectum once again, front to back. I finished washing the back part. I am now going to rinse the back part, back half, with the same method. First corner, vagina to the rectum, front to back. Second corner, top buttock, front to back. Third corner, bottom buttock, front to back. And final corner again, vagina to the rectum, front to back. All right, Mrs. Jones, I have finished rinsing your buttock. I'm now going to go ahead and pat you dry. Do you feel dry, Mrs. Jones?
Yes, thank you.
Great. I'm now going to go ahead and remove this wet barrier. I'm going to have you come back to your back for me. Pull it from the other side. I'm going to cover you back up, Mrs. Jones. How do you feel?
It's good, thank you.
Great. All right, Mrs. Jones, I'm going to go ahead and lower your bed. I will be giving you your call light, so if you need anything, please don't hesitate to ring your bell and we'll be right with you, okay?
Okay.
I'm going to unprovide your privacy. And I will be going to take care of my supplies by removing all my dirty linen, putting them in the dirty linen basket, and emptying, rinsing, and putting away your basin and soap. Have a great day.
You too, thank you.
Now that I have put my dirty linens in its proper receptacles, I'm going to go ahead and empty my basin. I'm going to rinse my basin. I'm going to dry. And put it back to storage. I will remove my gloves and perform hand hygiene. I will now be performing my hand washing skill. So for this, I just want to make sure I turn on the water. I also want to make sure that my body is not touching any part of the sink. I will go ahead and turn on the water to a comfortable temperature. I will I'll start by making sure that my hands are completely wet by rinsing them under the faucet. Making sure to get at least 2 inches above my wrists. Making sure that my hands stay in a downward position so that it does not, water does not go off my arms. I'll apply soap. I will form a lather and cover all surfaces of my hands. I will make sure to do my wrist on both hands. I will interlace my fingers. I will make sure to clean each finger. And I will clean the underneath my fingernails by rubbing them against the opposite palm of the opposite hand. And I will make sure I have done this for at least 20 seconds before I go ahead and rinse my hands off. Again, you want to make sure that your hands stay facing downwards. Make sure to get at least 2 inches above the wrists. And during this process, I have made sure that my hands did not touch any part of the inside of the sink or the faucet. I have my first towel and dry from my fingertips upwards. So cleanest to driest. In between the fingers. Fingertips to wrist. In between the fingers. Now that my hands are completely dry, I will take another paper towel, turn off my water, and my hand washing skill is complete.